Rhode Island is taking steps to make sure the COVID vaccine is available to anyone who wants it. With new recommendations from the Food and Drug Administration, there are concerns that the latest vaccine won't be available everywhere and insurers won't cover the cost. On Friday, Rhode Island Governor Dan McKee announced that the Rhode Island Department of Health and the Office of the Health Insurance Commissioner issued a bulletin to order insurers to cover the vaccine in accordance with recommendations from major medical organizations, including the American Academy of Pediatrics and the American Academy of Family Physicians. Here in Pennsylvania, the pharmacy chain CVS will resume more routine access to COVID-19 vaccines after state regulators adopted a new rule designed to counter federal uncertainty around immunization guidelines. The retailer in late August said it would only provide the shots to people with a doctor's prescription due to lack of clear direction from the Centers for Disease Control, an agency overseen by longtime vaccine skeptic Robert F. Kennedy Jr. On September 3rd, the Pennsylvania State Board of Pharmacy voted to let providers administer vaccines based on guidelines from several medical societies that favor broad access to immunization. Previously, the regulations focused on following recommendations from the CDC and Advisory Committee on Immunization Practices. Once again, a federal panel Kennedy has upended. Given that background information, Governor Maura Healey, a Democrat, joins Morning Joe to discuss how Massachusetts is taking measures to ensure vaccines remain accessible to everyone and to criticize the Trump administration, in particular, Health and Human Services Secretary Robert F. Kennedy Jr.'s cuts to public health across the country.